Hello. Uh, Today is the 1st of January 2018. Okay, it's the beginning of a new year. And today's video, I'm going to talk about diabetes. Okay, diabetes. Now, diabetes is caused by excessive sugar in the blood. Okay, no, not exactly sugar, it's glucose. Okay, now why do we need glucose inside our blood? Yeah, why do we actually need glucose in our blood? Other than delivering the glucose all over the body, this is the blood is actually a transport channel to deliver glucose to all parts of the body. It is also required to communicate with you. Okay, to communicate with you. Now, the brain take care of all the bodily function. It can operate by itself, okay, without you. But you need food. You need food in order for this body to survive. So there is a way that the body communicates with you. When the body needs food, he will bring down the glucose in the blood. Okay, it will bring down the glucose in the bloodstream, and so you feel hungry. Okay, when the glucose is low in your bloodstream, you feel hungry. So this is where you take your food. When you eat your food and it is enough, okay, so the glucose, as you eat, the glucose in the blood will increase. Okay, so once it decreases a certain level, you will say, oh, I'm full already. So the glucose is always fluctuating within a certain range, okay, to tell you I'm hungry and to tell you, yeah, I'm full. Okay, so it goes up and down like that. Every time he feels hungry, the glucose will go down, and when you eat the food enough, it will go high to tell you, oh, I'm full already. So it's a way to communicate with you. Okay, but sometimes it go haywire. Okay, sometimes it go haywire, and that is why we have diabetes. Now, before we proceed, I want you to watch this video. Okay, this video is telling you how the body process food. Okay, process food in your body. You see this video.
When you eat food that contains carbohydrate, it's broken down in the stomach and digestive system into glucose, which is a type of sugar. We need glucose from food because that's what gives us energy. Carbohydrate-containing foods are things like starchy foods, sugary foods, milk and some dairy products, and fruit. This glucose then moves into the bloodstream, and the body detects that the blood glucose level is rising. In response to that, the pancreas, which is a little gland that sits just underneath the stomach, starts to release a hormone called insulin. And it's insulin that helps our body get the energy from the food we eat. The bloodstream then takes the glucose and the insulin to every cell in our body that needs it. To make this easier to understand, let's look at muscle cells. At the muscle cells, it's insulin that allows the glucose to get into the cells where it can be used for energy. It's a bit like insulin is a key unlocking the door to the cells so the glucose can get in. That way, the blood glucose level starts to drop. But the blood glucose level can be topped up at any point by the liver releasing extra glucose that it has stored. The blood glucose rises again, and again the pancreas produces more insulin to move with that glucose through the bloodstream to the muscle cells, open the doors and let the glucose in. The body functions best with the blood glucose at an optimum level. It doesn't like it if the blood glucose rises too high. Normally, there's a cycle within the body which balances out the glucose and the insulin level, and this is achieved by the food you eat, the pancreas, and the liver.
So from the video you can see it's very important that the body has insulin. Okay, insulin helps to break down food. Okay, it helps to break down food. So now diabetes, there are two types of diabetes. Okay, one is type 1 diabetes and the other one is type 2 diabetes. Okay, now what's the difference between type 1 and type 2? Now type 1 diabetic, I will explain the type 1 diabetic first, is when your immune system go haywire. He start to attack the cells that are producing this insulin. They start to attack the cell that is producing insulin, and as a result your body cannot produce enough insulin. Okay, your body cannot produce insulin, and therefore you get type 1 diabetes. So I want you to watch this video.
In type 1 diabetes, the body isn't making any insulin at all. This is because of an autoimmune response whereby the body has destroyed the insulin producing cells in the pancreas. We don't entirely know why that happens in some people and not in others.
Now, type 1 diabetes is because your immune system is going haywire, and it is destroying all the cells that are producing insulin. And why is that so? In my previous video, I've really explained about leaky gut. Okay, about leaky gut, about food going into the bloodstream and all that. Watch my previous video. Now, this type 2 diabetic, is a little bit different in the sense that there are too much insulin in your body. Okay, why is that too much? Type 1 is not enough insulin. Type 2 is too much. Why? That is because when every cell has an opening, it has an opening where insulin can go in. And because there are too much this lipoprotein, you remember the previous video I talked about lipoprotein, LDL and HDL. Now, when you have too much LDL, it is still okay. There's nothing wrong with that, having too much LDL. The problem arises when the LDL is of a smaller size. The molecule of the LDL, low density lipoprotein, is of a smaller size. When it is a smaller size, it becomes very sticky. Okay, it's small and sticky. So this LDL, when it is small and sticky, it will stick on the entrance of the cell. Okay, it will stick on the entrance of the cell. As a result, insulin cannot go in through that opening. Okay, because the opening of every cell that is stuck with this sticky lipoprotein, it is very sticky, so it can't go in. So as a result, the body requests, I need more glucose. So the body will respond by producing more insulin, so that the body can absorb the insulin. But you already have the insulin in the body. Okay, you already have the insulin in the body. Only thing, the cell is not able to absorb. Okay, it's not possible to absorb the insulin. But the liver won't know. The liver keep on producing. Okay, the pancreas also keep on producing the the insulin. Okay, insulin. Now, later on I will explain that even the liver also produce some growth hormone that acts like insulin. Okay, so breaking down of this glucose, helping the cell to absorb glucose. Part of it is being assisted by the liver growth hormone and partly by insulin. Okay, so the liver also helps in producing this, but the problem with the cell is that there are too many sticky LDL sticking. As a result, there is no way the cell can absorb insulin or the growth hormone. Okay, I want you to watch this video.
So in type 2 diabetes, the carbohydrate containing food is broken down into glucose in the stomach and digestive system as normal. That glucose then moves into the bloodstream. The pancreas starts to produce insulin, which moves with the glucose through the bloodstream to all the body cells which need glucose for energy. However, the glucose can't always get into the cells because the locks to the cell doors have become furred up with fat deposits. That means that the insulin can't open the cell doors properly. So the level of glucose in the blood continues to rise.
Okay, from the video you will note that insulin is just like a key, okay, the key to open the door. So once the door is open, then glucose can go in. So without the key, you can't open the door, you see. So insulin is required to open the door for the, what do you call that, glucose to go in. So in short, type 1 diabetic is when you don't produce enough insulin. That is because your immune system is destroying the cell that is producing insulin. Type 2 is diabetic is when your body is producing enough insulin, but the glucose cannot go in. Yeah, why? Because the key cannot go into the keyhole. Why? The keyhole has sticky this LDL, so the key cannot go into the keyhole. As a result, the door cannot open. Yeah, insulin is just the key. Okay, insulin is just a key. Now, can we cure diabetic? Yes, diabetic can be cured very easily. Okay, very easily. I would recommend a 30 days cannot. 3 months diet. 3 months diet. Okay, I would recommend a 3 months diet. And when you want to, get rid of diabetic, all you have to do is you try to avoid rice. Yeah, for 3 months maybe you don't eat rice, and for 3 months you don't eat bread, white bread or wholemeal bread, no rice. 3 months. Okay, but there are a lot of food that you can eat. Okay, I'm showing you the type of food that you can eat. Okay, I'm also trying to recommend some Shaklee products because at the end of the day, when you don't eat rice and what do you call that, bread or things like that, and you eat all those other things, your nutrition may not be enough. So it is very important during these 3 months you take the clean vanilla shake, and DTX. Your liver is very important. Okay, your liver, because it's helping in producing, regulating. Okay, your liver is helping to regulate the production of this insulin also. Yeah, so DTX is very important for your liver. You need to take that, and to solve the sticky LDL, I would recommend you take the lecithin. Okay, I would recommend you to take lecithin. Okay, I want you to watch the next video. Okay, the next video, this doctor has already cured many people of diabetes, and it's very simple. Okay, very simple. Less than a month, everything is settled. But I would recommend you go for a 3 months program. That will be more sure that you stay healthy whole life. Okay, but this video says this doctor has already helped so many people. Okay, you watch this video. Okay.
Type 2 diabetes can be reversed in many, if not most situations, especially if we start early. Not only do we need to let people know this, but we have to start giving them the practical advice so they can do this. Consider carbs. First, here's a shocker for you. We don't need them. Seriously. Our minimum daily requirement for carbohydrates is 0. We have essential amino acids, those are proteins, essential fatty acids, but nope, no essential carb. A nutrient is essential if we have to have it to function, and we can't make it from something else. We make glucose, plenty of it, all the time. It's called gluconeogenesis. So, we don't need them. The overconsumption of them is making us very sick, yet we are continuing to recommend to patients to consume close to, if not more, than half of their total energy intake every day from them. It doesn't make sense. Let's talk about what does. Cutting carbs, a lot. Yes, in my clinic, we teach patients to eat with carbs as the minority of their intake, not the majority. So how does that work? Well, when our patients decrease their carbs, their glucose goes down, and they don't need as much insulin. So those insulin levels drop and fast. And this is very important because a study looking at our National Health and Nutrition Examination Survey data, better known as NHANES, showed that the single biggest risk factor for coronary artery disease is insulin resistance. It is responsible for a whopping 42% of heart attacks. Low-carb intervention works so fast that we can literally pull people off of hundreds of units of insulin in days to weeks. One of my favorite stories is a very recent one. A young gal, but who had an almost 20-year history of type 2 diabetes, came in when a physician from another clinic told her she was just sick and should probably get used to it. Her diabetes was way out of control. This despite the fact that she was on multiple medications, including almost 300 units of insulin that was being injected into her continuously every day via a pump. All of this, remember, blood sugar still out of control. So we put her on a low-carb diet, and now let's fast forward 4 months. She lost weight, yes, but better than that, sick no more. Her blood sugar levels were now normal all of the time. This on, get this, no diabetes medication. Gone was the 300 units of insulin, no more insulin pump, no more pricking her finger multiple times each day. Gone, all of it, no more diabetes. One of the greatest joys of my job is to be able to tell a patient like this that they no longer have diabetes, and we ceremoniously take it off their problem list together.
Okay, from the testimony of this doctor, you will know that a lot of people who are already in the very advanced stage of diabetic, where they have to go for their daily insulin injection, that can be taken care of also. That can be taken care of if you just keep out of the carbohydrate, like rice, and bread and things like that. Okay, so I'm going to leave you some link behind. Okay, there are other videos, especially I want you to watch the video of this Oprah, the TV personality. That video is also nice. They don't tell you how to cure diabetic, but they tell you this doctor has already operated on many people with heart disease as a result of diabetes. Okay, it's worth watching. So I am giving you that link. There are a few links. You watch this video. Very important. Okay, if you are suffering from diabetic, it's a must see video. Okay, bye bye.